Hi, I'm Dr. Martin Rutherford. We're going to be talking about gluten sensitivity today. Again, update, facts and fallacies explained. I am also a certified functional medicine practitioner and also a chiropractor for 29 years and other things.
But longer than that, 36 now.
36 years. I don't have my serotonin going today. And this is...
Sorry to correct you. It's 1979.
No.
That's when I came into practice. Yeah. What? Longer than I've been alive.
It's been a long time. And a lot of patients.
Dr. Randall Gates, board certified chiropractic neurologist, as well as being a chiropractor.
And the vast majority of that long time has been spent trying to address chronic pain from musculoskeletal aspects, primarily in the beginning, then ultimately to neurological and metabolic aspects. We have put together functional neurology relative to the brain and the nervous system with functional medicine relative to everything else, basically. And we have inadvertently, if you will, kind of developed a chronic pain paradigm from treating thousands of patients. And we're here to share with you the things that we see and know. People say, well, you guys sound like you know everything. No, I think we don't. I think we sound certain about the things we tell you because these are the things we do every day. And so we clinically know that what we're saying consistently works. And we're sharing that with people because there's 120 million chronic pain patients running around this country, according to Harvard and Stanford, as well as I think it's the National Health Institute. But anyway, it's like 118 million or something like that. And so that means that whatever we're doing in this country to handle that isn't working. And last night, Dr. Gates and I were very humbled and honored to be invited to a private presentation by a couple of very accomplished, well-known local musicians. They're affiliated with our local college, University of Nevada, Reno. And one has been, I didn't get it, was she in for 50 years? Was she 25 years a professional? And then did this? Okay. Mm-hmm. So one's been a professional musician for 25 years and now has developed a health online or a health radio station for hospitals with healing music. And the other one was just an amazingly accomplished musician who's going to be going into this contest of the top musicians in her world. So it's kind of an interesting, it was only intimate, maybe 20 people or something like that. And the musician of 25 years, one of our patients was the one who invited us. Our patient is gluten-free. So that brought up the topic of, well, these aren't gluten-free, just make sure that that you make believe they're like the sushi things when you go into the sushi store and they have the plastic sushi, and just make sure to this gentleman that you don't eat these. And she said, but you only need to not eat gluten if you have celiac disease. But if you don't have celiac disease, she said, it's dangerous.
It's dangerous.
She said it's dangerous
to eat a gluten-free diet.
So, and
this
if you're
is not
watching,
to slam her. This is not.
I was going to say, if you're watching, we're not slamming you, because I hear this. If I say every day, I am slightly exaggerating, okay, just to let you know. But I hear it a lot on the intakes. Well, I already tried to get off of gluten and I felt better, and then I didn't feel better. And I was told that if you're off of gluten, you only need to be off of gluten if you're the 1% or 3% or whatever it is of the people in the world that have celiac, which I happen to have. And so we were discussing beforehand how it is interesting that, and again, not to disparage this was a wonderful lady, but people who just don't have the background to know that and have grasped onto what I call the urban myths out there that can be very detrimental, embracing, especially if you have a sensitivity to celiac and you're not aware of it. There was, however, another lady there. And this lady was a research scientist, and she was not a research scientist in our field. She was a research scientist in the field of building structures with concrete and different materials and figuring out how to make your bridges not fall over and things of that nature. But she was a research scientist. In the past couple of weeks, we've had a molecular biologist in here, and it's almost easier to talk to them because she came in with the gluten thing, I don't understand it, and so on and so forth. And when Dr. Gates started sharing the data with her, she said, well, the research is, and all research scientists say this, interestingly. They say, well, research can be, it can be subsidized, there can be grants, people who order the research and pay for it kind of influence the outcomes. And we said, that's totally true, except we've treated thousands of patients and we've used that research. Dr. Gates, and we said, go online, we have 200 hours. Dr. Gates has probably put together, I don't know, a couple thousand.
At least, and not all of it's attached to our broadcast. I mean, in my email, I have thousands of references.
But if you even just looked at all of our broadcasts, which don't bother because there's a couple hundred hours of it, but every one of them has 15, 20, 25, 35
absolutely.
research articles attached to it. So when this person understood that we had practical experience, truly what you would call evidence-based medicine, not what they're calling evidence-based medicine, she started to listen. She started to ask extremely good questions. And the next thing you know, she was like, wow, this is very complex, isn't it? And we said, yeah, it is. And so that's why we're doing this today. We do this gluten thing all the time. It's a big part of what we do. It's far from the only part of what we do, which is another big misunderstanding among people. I got off the gluten and I didn't get better. And so we are going to clear up with great certainty what we're going to say. And when we're not certain, we'll let you know some of the facts and fallacies that are explained, because this is extremely important for a substantial portion of people who have chronic pain. I don't care if it's fibromyalgia, peripheral neuropathy, irritable bowel syndrome, chronic fatigue, chronic thyroid problems that aren't responding to your drugs. I don't care if it's dizziness, vertigo, balance, migraines, restless legs, and more. This is an important subject. Maybe I did take my serotonin today.
Yeah, you're fired up.
So let's do a simple overview of wheat, of gluten, what celiac is. Let's parse out what's a wheat allergy, and then a sensitivity, which we call non-celiac. Well, not we call it, the research calls it non-celiac gluten sensitivity. And I don't know, to me, it's a little confusing in a sense of just get off the gluten, okay? But we're going to really bring this out to you for those who have the inquiring minds or those of you who are confused. So gluten, why is it a problem?
And we're going to make these definitions because I'm not going to go back to them as we go through this broadcast, because it just gets too laborious to keep going back and explaining what's differentiating between all of these three.
Okay.
So gluten is a protein. It's a molecule that's within wheat. Wheat, as most of you know, is in a lot of the products that we eat, from breads, pastas, cereal, grains, to gluten can be in things such as ketchups. It can be in condiments like barbecue sauce. It can be in soy sauce, salad dressing, beer. So I was going back to one of my favorite satirical comedies, comedy shows about what
we won't tell you what it was.
Exactly, but the gluten is in a lot of products, as is wheat, as you may know, and pastas. I hope I mentioned that. Celiac disease is an autoimmune reaction. The immune system is killing the gluten molecule, and it's therefore also killing the gastrointestinal tract. So you will see definitive signs of the gastrointestinal tract being obliterated when your gastroenterologist sticks a camera down your throat and they take a little piece of your intestines out and put it on a microscope slide. There are also very specific blood tests associated with celiac disease, specifically the tissue transglutaminase enzyme antibodies, as well as the anti-endomycel antibodies as well. Now with wheat allergy, just as it says, an allergy is a different type of immune reaction than most autoimmune diseases. Allergies, think of peanut allergies. A kid eats a peanut and then all of a sudden they start going into anaphylactic reaction. Wheat allergy is very similar. So someone eats wheat, they have an immediate reaction. Lots of times they'll have diarrhea. They may have other signs of anaphylaxis. And this is usually confirmed by a gastroenterologist. Now, it's very important that celiac disease and wheat allergy are basically screened for and ruled out in someone who thinks that they have gluten sensitivity. And gluten sensitivity is defined, or non-celiac gluten sensitivity, or now as it's being referred to as non-celiac gluten and wheat sensitivity in the literature, is defined as you basically going on a gluten-free diet, feeling better in terms of whatever symptoms you have, ranging from depression to brain fog to gastrointestinal symptoms to numbness in your feet to headaches. And then you feel better being off of gluten, you introduce gluten back in, and you don't feel as well in terms of your symptoms. There's a specific way to do it now. They're saying that you need to consume at least 8 grams of gluten a day, which, you know, how you quantify that, you know, how much pizza you're eating can be semi-difficult, I would presume. But you do that for a week, and then you go off of it for a week, and you see how you feel.
So the key there, and we're going to talk about this later as I look at the outline, but the key is, to me, is if you have, I have celiac. So if I have celiac and I eat gluten, it gets ugly when I go to the bathroom the next day, okay, or maybe the next couple of days. But when you have non-celiac gluten sensitivity, much of the time you're not going to get a gut reaction. You're going to get a neurological reaction. This is what Ray cognited on last night when we were talking to him, is that it's going to affect your brain function, any type of depression, anxiety, brain fog, short-term memory loss, those types of things. It could create balance issues. It could do a lot of things, or it can affect your feet. And Dr. Gates is going to talk about this in a lot more specificity later, but I just wanted to kind of parse that out. Non-celiac gluten sensitivity seems to affect nerve tissue more, not particularly gut. Celiac seems to really affect the gut. Then once it affects the gut, that can affect everything: nerve tissue, thyroid tissue. But really, it's like, oh, doc, you know, I'm starting to have my problems again. And I say, well, how's your diet? Well, I went back to eating gluten. Well, why'd you do that? Well, I ate it and it didn't bother me. In other words, I didn't bloat, I didn't get diarrhea.
Right.
Well, why are you back here? Well, my dizziness is back, my brain fog's back, I can't remember, and my feet are starting to hurt again. Those are all neurological symptoms. So fallacies about symptoms. So those are that's kind of the core data.
Right, exactly. In fact, I was just saying, I want to skip down here.
And I would also maybe say that the testing that's out there,
oh, good point,
maybe not always reliable. I don't even know if that's a good term. They use terms of sensitivity and specificity for testing to tell you how accurate it is, and the sensitivity. So in other words, if a test has a 60%, I'll just use the same sensitivity and specificity. It means that 40% of people coming in there who have celiac will be told they don't have it. Okay, but that's probably the wrong percentages. But the tests are not perfect.
The tests are very imperfect. Okay, very imperfect, and you have to be very precise in what you're looking for with these tests too, which is not really documented in the literature completely, except now it is. And I'll try and go into that.
Okay.
So as Dr. Rutherford is saying, that a lot of these gluten-based reactions are neurological. I am actually going to tie in some new literature today discussing IBS and gluten, stuff that's just come out, which is actually going to change our thinking as well. But starting off, one of the research articles we attached today was discussing cutaneous manifestations of gluten sensitivity, which is relatively cool because we've seen a lot of these patients where they have things called, they've been labeled as having eczema, or they've been labeled as having psoriasis, and they go on a gluten-free diet and all of a sudden their psoriasis or their eczema starts to go away or dramatically improves. And there's a lot of discussion in the literature about this relationship between the gastrointestinal tract and our skin tissue, mainly because it's basically all one and the same. Your gastrointestinal tract is made of skin, your outside of your body is made of skin. So if there's inflammation here, there possibly could be inflammation manifesting on your outward self. So they took a certain number of patients, and they basically found most of them had gluten sensitivities. And with a gluten-free withdrawal, they got better. And we're going to outline these studies and this data because it's important. We've talked about gluten a lot, as Dr. Rutherford says, and we've talked about a number of studies and a number of reasons why gluten sensitivity is real, but I kind of want to bring you the up-to-date information and then summarize it with what we've said before. Psychosis. Psychosis is where basically people kind of, they may hallucinate. You would kind of think of them as going crazy. And cases of psychosis are now being demonstrated to be due to gluten sensitivity. Schizophrenia is a great example. Schizophrenia is a chronic neurological disorder where people tend to hallucinate. They tend to have a flat affect in between episodes. They tend to act kind of irrational. And with schizophrenia, it was discussed back in the 1950s that there was less schizophrenia in areas where people did not eat as much bread, which was kind of fascinating. And then psychiatrists started observing that some schizophrenic patients were actually worse in terms of their symptoms when they were fed gluten-rich meals versus when they were deprived of gluten.
Mm-hmm.
Since then, in the literature, they've really tried to dissect this association between, again, celiac disease and schizophrenia, and it's not there. And they've looked for it, and they've looked for it, and they've looked for it, and they thought they found it, and it's not there. But then they started saying, well, we actually need to separate how we're running these tests. So as I said before with celiac disease, there's something called the tissue transglutaminase enzyme. Everybody remember that? Hopefully you do. Well, the tissue transglutaminase antibody, so to speak, seen with celiac disease is different than the tissue transglutaminase antibody seen with schizophrenia. It's more of a neurological based antibody rather than a gastrointestinal based antibody. So they're finding that when schizophrenic patients eat gluten, then they make all these antibodies to their brain, and that is pivotal in the biochemical sequence of events that instigate the schizophrenic neurological degeneration.
And there's a point right there. Just every research study that comes out, that's the new great thing. Okay, and these research studies are generally limited. Dr. Gates just gave a great example as to how they just didn't have the data at that time to know that there were other things. Well, we don't have the data there. I mean, we know what we know today, but things are going to continue to be discovered. And as we discussed with the other research scientists last night, there are so many factors when you're trying to evaluate a human being. How many people go into a research study have their stress levels evaluated while they're going through that? That changes everything. If that person is going under post-traumatic stress syndrome, they're going through a divorce, they're having a difficult time at home, they're flooding their system with stress levels, that changes your whole body chemistry, particularly your gut chemistry and particularly brain chemistry. And now you're trying to do things. So there's so many different variables, but what Dr. Gates indicated right there was how tenuous this research is. So thus for us, we say, look, if we do this and it works and their psychosis gets better, we're good with that. We'll figure out what it is later relative to the research that's coming out. But so again, and I'm really pointing that out because that leads to the complexity of this. And it kind of shows you like the gross statements of, well, if you have celiac, then you should get off the gluten. But if you don't have celiac, that it's very dangerous. It's like, that's just not a correct statement. It's not even close. And so it's a very simplistic statement, and it goes against everything we see. And now as things evolve, it goes against even what the literature says. So just understand this is an evolving amorphous situation. And even for us, we have learned so much in the last 5 years from just get off gluten. And we got, improvement there, but nothing like what we're getting now. And depression would be you're going to talk about depression and schizophrenia, which are along similar lines to the psychosis.
Exactly, because they're basically neurological reactions. One of the best pieces of evidence that came out regarding depression was the study that theoretically or originally debunked non-celiac gluten sensitivity. It came out in 2013, where one of the lead authors of the study, who was a proponent of the diagnosis of non-celiac gluten sensitivity, was looking at irritable bowel syndrome patients. So you remember Dr. Rutherford saying when he eats gluten because he has celiac disease, he gets a bowel reaction. Well, a lot of people who were avoiding gluten were doing so because they thought it was making their diarrhea or their constipation or their bloating or their gas worse under the heading of irritable bowel syndrome. And so with this, in this study, basically, and we've talked about this one before, the author's name is Brenner, I believe, Dr. Gibson, out of Australia. He took one group, he took all these IBS patients, put them on a baseline diet where they cleaned out their gut. And then he gave one group gluten, he gave another group gluten and dairy, and he gave another group just dairy. And the group that got gluten and dairy felt significantly worse. But he said that the group that got gluten only and dairy only did not feel significantly worse. But then he replicated his study a year later, and he found that those who got gluten only actually felt depressed to a clinically significant level. And he came out and he said, well, non-celiac gluten sensitivity likely does exist then, after he went back and said it didn't exist. It exists because it's causing a neurological reaction in these patients. Right. And so now more and more evidence is coming out about unipolar depression and gluten and the effects that it possibly could have on that. And they're really studying that right now. It's not necessarily definitive to the entire depressed population, but for those who eat gluten and they feel worse, lots of times it's because of a depressive aspect of the gluten on their brain. So that's very interesting. Autism, the literature is pretty definitive now that a lot of autistic kids respond.
Can't believe you're saying this. But Doug Gates likes to avoid controversy when all possible. I'm like in shock that he's even going to say this, but it's true.
Pretty definitive that a lot of autistic patients do better on gluten-free diets. It's discussed heavily. I've mentioned another journal's World Journal of Gastroenterology, I think last year, where they came out and said, we need to investigate this gluten and gut reaction further on autistic patients. Because the pediatric societies did not want to tackle this issue head on. But the gastroenterologists were saying, well, if they're not going to do it, then we're going to do it because the evidence is there and somebody needs to reach out and start helping these kids a little bit more. And it appears that the evidence is strong enough to suggest that they need to do that. And as Dr. Rutherford was alluding to, I mean, there are so many conditions that can be tied into gluten. From peripheral neuropathy, we've discussed that. 34% of idiopathic peripheral neuropathy patients are being found to have a gluten intolerance as the cause of their nerves dying and degenerating down their feet. People with lack of balance, called gluten ataxia, are being found to have this reaction to gluten that then affects their brain. Not to mention the Hashimotos patients, which is where the immune system kills the thyroid. In 2008, the Journal of Thyroid found a high association between those who had Hashimotos and gluten antibodies. Then we're finding that the antibodies to the thyroid can hit the cerebellum. So maybe you don't have gluten ataxia, but maybe you have thyroid antibodies that can actually affect your cerebellum. Then they're finding that Hashimoto's patients, once they have these immune antibodies, 48% of them have degeneration of the vestibular nerve, which is your balance center.
And if you're hitting your cerebellum and your vestibular nerve, you can't walk, you feel like you've been on a boat or like you're drunk, you go to the doctor, they look, or you may not have the ear issue, they look at the ear, they look at you, they take an MRI, nothing's wrong. Then you have somebody comes in, they've been to the Mayo Clinic, no kick against the Mayo Clinic. I got someone coming in today who's been to the Mayo Clinic with their husband, who I'm pretty sure is going to ask me, how do you guys know this when the Mayo Clinic doesn't know that? And it hits their cerebellum. There's no way to know other than to know this data. Now you tell that person, well, we know this. We know that if we take gluten away from your wife, it's probably going to help her a lot. Your credibility kind of goes down a little bit if that person's not conversant with the data that's out there. So it's a bit of a battle out here, but boy, it's important when it's important. We did a presentation here at this time, a month ago maybe, or on the argument potentially for gluten-free
for everyone. We did that to our patients. Everyone. We didn't do that for
we did it to the
patients.
Yeah. And a lot of things that you just said though are in that presentation.
Right.
And the data. I had a friend who wrote an article that was published years ago on the argument for everyone being gluten-free, and you can make the argument. I'm not completely there yet because clinically it can get really difficult, but we mostly treat autoimmune patients with neurological problems. It turns out that seems to be the core of chronic pain, and for our patients, I mean, it's huge.
It's huge.
It's probably the closest thing we have to a uniform recommendation for every patient that comes in. Everything else is very, very unique to that patient's individual biochemistry and neurology. But most, I'd say 97% of our patients end up gluten-free.
Yeah, and then taking it even farther,
it produces results.
We treat a lot of fibromyalgia patients. Fibromyalgia patients are a significant percentage of the population. Fibromyalgia patients, they showed in Rheumatology International last year in November that they took 20 fibromyalgia patients, put them all on gluten-free diets, and all 20 got better. They either got off their medications and went back to work. They had extremely significant improvements in their symptoms. And then now we're talking about the effects that gluten can have on the barrier of your intestines.
I was just going to say, just getting off a gluten-free diet, it's just what we've seen is just the tip of the iceberg.
It's the tip of the iceberg.
And they had that dramatic result. Now what he's about to talk about is the rest of the iceberg.
Right, the rest of the iceberg. So within the gastrointestinal tract, we have our food, but we also have bacteria. We have bacterial byproducts, if you want to think of it that way. We have digestive secretions, a whole mess of stuff in this tube that is your gastrointestinal tract. And you should have a nice barrier separating your gastrointestinal tract from your bloodstream. And right at your gastrointestinal tract is where 70% of your immune system is, because it's ready and waiting in case you consume too many cholera bacteria, or you consume a parasite, or you consume some other nasty bacterial or viral pathogen. And what we're finding is that gluten actually breaks down that barrier. And that came out this year, Journal of Nutrients, I think 2015. The last author in the study is Dr. Fasano. It's his group, who's one of the world's foremost researchers on gluten. He was the one actually to break the code and show that celiac disease is way more common than we thought. It used to be thought to have a prevalence of 1 in 1,000. Now it has a prevalence of 1 in 100. So 1% of us have celiac disease. But they showed that even normal subjects, when they eat gluten, that the barrier of their intestines breaks down. They also showed that non-celiac gluten sensitivity patients had it to the same degree, I believe, as a celiac disease patient who's in an active flare. Don't quote me on it. I can get you the study. But in essence, celiac disease patients, non-celiac gluten sensitivity patients, and normal controls all had breakdown of their barrier integrity at their intestines with the consumption of gluten, which is even more important because we're finding that with a lot of metabolic diseases like obesity and diabetes type 2, or adult onset diabetes, if you want to think of it that way, that there's also a bacterial issue in the intestines where you can have overgrowth of the wrong types of bacteria. You can have certain bacteria that release little finger-like projections off of them that go into the bloodstream and cause insulin resistance and weight gain and inflammation. Metabolic syndrome, if you've heard that, and intestinal permeability is a critical piece of that. So this is where gluten is tying in. I mean, I think we've probably talked about 10 major conditions thus far. Now we're tying it into diabetes.
Intestinal permeability also leads to further food sensitivity.
Right, and now we're tying it in with diabetes, weight gain, which is basically affecting, 2/3 of the population, and then we can tie it in with rheumatoid arthritis because they're finding pieces of bacteria from the gut in rheumatoid arthritis patients in the joints of the hands. So hopefully from this, you're getting the notion in this argument that gluten is a much bigger issue for our health care system, for the health of our society, than just celiac disease patients.
Well,
and to make the assertion that it's dangerous to go on a gluten-free diet if you don't have celiac disease is not accurate. And it's not accurate because we have these chronic diseases that Dr. Rutherford and I talk about all the time with chronic pain. They're literally destroying our healthcare system, destroying the lives of hundreds of millions of people, about 120 million people in this country. And there's not an accepted solution for it, but all the literature is pointing back to one direction, which is right here in the gut.
Right. So, I think really the main thing is that when I look out there and I'm listening to folks and we're having these discussions in our consults, it's still kind of out there. People are starting to get gluten is something, but now it's kind of like, well, yeah, but it's not all that. Whereas before it was, well, gluten's crazy, it's stupid, it's this. Now it's like, okay, I get the gluten thing, but it's really not for everybody else. It's just for this. We do vaccinations for flu vaccination right now. I think it's actually more important to know that you have a gluten sensitivity than it is to get a vaccination for the flu, given the fact that they're admitting that the last 3 years, the flu vaccination was the wrong vaccination. This is not the wrong target. This is an important and real and legitimate area of concern, almost like you're getting some sort of outside entity that is attacking you, like a virus or a bacteria or something like that. And I think that's really the best analogy I can give to kind of put people's head in the right direction and try to cut through the confusion of gluten-free products that are being put out there, for entrepreneurial reasons and things of that nature that kind of fog this up. You just need to know that eventually, 5 to 10 years from that, you're going to be hearing what we're saying right now. You're going to be hearing it in the newspapers, and you're going to be hearing it here and there. And let's you want to go over the fallacies? Okay.
And on that point, so people say, well, a gluten-free diet is not nutritious. We're not for all this gluten-free craze.
That's one of the fallacies.
Exactly.
One of the fallacies is people will say a gluten-free diet. If you don't have celiac, don't go on it, because it's not good for you. It's not nutritious. You can't get your
vitamins
and minerals out of it.
They're saying that because cereal grains are enhanced with a bunch of vitamins and minerals, and then they're also saying that because the gluten-free products like rice, they're made with rice flour, have a lot of arsenic in it, so that can be deleterious or poisonous to your system. Really, the fact of the matter, what we found is that with these gluten-free diets, really gluten is the tip of the iceberg, and there are other foods within the diet that can be equally as bad, like these gluten-free grains and these processed gluten-free cereals, processed gluten-free
which
breads.
are another complication, because they're the base of the food pyramid that's being taught today, with no disrespect to dietitians, et cetera. But this is the science. The science is going against what you've been presented by the government agencies that put the food pyramid together. And we won't talk about those influences,
but I mean,
they're there.
You can easily argue that a diet rich in, lean meats, vegetables, primarily vegetables and fruit, is probably the ideal diet we should be eating.
Yeah.
Because there's plenty of vitamins and minerals in your vegetables and your fruit.
We went to a seminar almost 2 years ago this week.
Yeah.
Almost 2 years ago this week. There was 19 presenters from all over the world. It was about 50 hours over the period of a week. And all they talked about was fruits and vegetables and fruits and vegetables and fruits and vegetables. 2,000 peer-reviewed journal references there. And they would occasionally allude to fish. And then they kind of almost gratuitously said, and you could eat beef. And they had this piece of beef up there with no marbling. That was the perfect beef. It probably cost $20 an ounce or something like that, for people. They were basically kind of de-emphasizing the beef stuff. But the point being, that's the reality of it. The reality is you can eat fruits and vegetables, and you can eat properly. And yes, maybe it's a little bit more difficult. Maybe it's not. I don't know. We do it. And I can tell you, it's I'm not lacking any vitamins or minerals. You look at and I've got celiac, peripheral neuropathy, chronic fatigue, Hashimotos thyroiditis, probably attacks against my fibromyalgia, attacks against my cerebellum, 8 concussions, blah, blah, blah. And I'm doing well. And I'm not doing as well as I maybe would be. Maybe sometimes you hear me kind of grasp for my words or something like that. If you've seen me trying to do this like 7 years ago, you would go, whoa, So, and I'm on this diet is the point,
right?
Okay, and I'm on this diet. Do I look like I think I'm like about 5 pounds still overweight. I'm pretty articulate. My nails are good. My hair is good. My skin is good. All you people out there are spending thousands of dollars wanting to make your skin look good. You eat this diet, your skin is going to look good. Everybody, it's the first thing we see. Their skin starts to shine, their eyes start to get clear, because your skin and your eyes are a reflection of what's going on inside. You could slop all of those $1,000 or $3 or whatever stuff on you. This is the problem. If it is, I'm aging. No, it's not aging. This is a big part of the problem. How amazing is that? How amazing is that? And I think we've answered what. And
I just want to concede one more thing. With the gluten-free diets, eating nothing but gluten-free breads and overeating the gluten-free breads and the pastas, that is unhealthy.
It's very unhealthy.
It's very unhealthy, because I've done it, and I think it is probably less nutritious, and it's reinforcing these negative bacterial populations in the gut that we've talked about at length in other broadcasts. So I just want to assert that.
If you're eating gluten-free out of a package, you're not eating nutritiously.
Right. So here's another fallacy. Yeah, that's a great point. There's no research to support gluten as a cause of IBS. So just attached a research article. I hadn't seen this one, came up this morning, where they took a big segment of IBS patients. Now remember, go back to that study I mentioned before from Dr. Gibson out of Australia. It's a Gastroenterology Journal, 2013, August. I think it's Journal of Gastroenterology. And I'm only pedantic in referencing these articles for you, because you need to know that all this comes from references, and I may not have attached it.
From the medical research field.
Exactly. I may not have attached it to today's broadcast. So in that research study, again, he put people on a baseline diet who had pain, abdominal bloating, diarrhea, constipation, took them on a baseline diet. Then he gave one group gluten and dairy, and another group dairy. And he found that the gluten and dairy group felt statistically worse, but the gluten group alone did not feel worse in terms of their bowel symptoms. However, attached an article today where they took a bigger segment of IBS patients, a much greater sample size, so to speak. And they did a washout period, and then one group basically got gluten and another group didn't get gluten. The group that got gluten felt very statistically worse, significantly statistically worse is a better way to say it, eating gluten in terms of their bowel symptoms than not eating gluten. So this shifts the argument back to gluten being a cause for IBS, which we have seen to be the case for a long time.
Oh, yeah.
Is it the only piece of IBS?
No.
No, not at all. There are a host of other bacterial issues that can be seen with IBS, bacterial overgrowth issues, leaky gut, anxiety, and then also other food reactions, termed FODMAP reactions, and other food immune reactions, termed food immune reactivity to grains and other foods. So it is very complicated, but again, there is data there to support gluten as a cause of this.
Lots of it.
Lots of it. And one of the other new things that we're finding with gluten sensitivity is this phenomenon called wheat amylase trypsin inhibitors.
Another big thing.
Okay.
Here. Another big finding.
Very big, because I referenced how the bacterial issue in the gastrointestinal tract can cause little finger-like projections to drift off and float into the bloodstream like dandelion flowers blowing in the breeze, as I commonly say. And when those dandelion-like flowers from the pieces of bacteria, they go into the liver, they activate inflammation in your body. Well, we're finding that this wheat amylase trypsin inhibitor from the wheat molecule can actually do the same thing. It can get into the bloodstream, activate these inflammatory responses in your body, which are really significant to a host of disorders. And now they're starting to hypothesize that is this one of the cruxes, so to speak, of the inflammation we see in our society. I don't think I mentioned to you, did you see the Time magazine article that came out like this week? It's all about inflammation. They're tying in inflammation to heart disease, to arthritis, to chronic pain, and Allah, here we go. Here's
People
another.
who drink noni juice have known that for years.
But yeah, you'd have to drink, you got to drink a lot of noni juice persistently when you could actually go to the cause
Right,
of the
that doesn't
problem,
get to the cause of the problem. Not putting down noni juice. If you're drinking it and it's making you feel better, keep drinking it. But you still want to find the cause of what's causing the inflammation that makes you have to drink that, and or take a drug or do whatever. Okay, the bottom line, and that's another thing. It's like, well, I'm not taking a drug, I'm doing this. That's great. It is great. Don't get me wrong. It's way better doing one of those anti-inflammatory products, and there are many of them out there, and most of them seem to have a segment of the population that they work for. The people that they don't work for, to them, it's obvious that there's something going on that these approaches aren't able to overcome. But the people that it's kind of helping, where they are helping a lot, they're not making the connection like, well, I got to go one step further and find out, why do I have to drink this stuff every day? Because there's something else obviously going on, or because when I stop it, I don't feel good. So those are the things that the research is showing. Those are the things that we're talking about. It's kind of interesting to hear the Time magazine put it out. Time magazine had a great article on chronic pain like 4 years ago. I quote it all the time when I'm doing lectures, and it basically says it basically says we do the medical community states we do a poor job at chronic pain. We don't know what it is. We don't know how to treat it. The head of the Harvard and the research division, as well as McLean Hospital in Virginia, states we do a very, very poor job. Quoting him, he said, we do a very poor job doing this. And the article is really great. God, it's like so long. And it talks about peripheral neuropathy and phantom pain and all that type of stuff. So I would be interested in seeing that. I don't know if they did as good a job on this as that, but if they did, it'll be a good article for you to read.
Mm-hmm.
Yeah.
Mm-hmm. So this wheat amylase trypsin inhibitor, that's a mouthful.
Causes inflammation.
Causes inflammation. That can be a big component as to why we're seeing so many systemic effects with what's termed non-celiac gluten sensitivity, which most of you should be pretty familiar with now. So hopefully after watching this broadcast, you know that this is science-based, this is evidence-based. The problems involved with gluten, as we discussed with the research scientists last night, are multifactorial. So it's not just gluten and celiac disease. It can be gluten causing breakdown of the intestines. It can be the wheat molecule, this wheat amylase trypsin inhibitor eliciting systemic inflammation. It could be gluten antibodies affecting nerves in your feet. It could be gluten breaking down not only your gut barrier, but then they're saying the blood-brain barrier, allowing immune inflammation to the brain, causing schizophrenia. Really, it's just whatever your genetics are, your genetics can be amplified, so to speak, by environmental factors like gluten. And so that's where this is so important, that you know this, that you pass this along to your friends, and that our society starts to look at problems like this as a dietary problem primarily, rather than a genetic problem. And if we start to look at it this way, we can really shift our healthcare in the future. Now, I know Dr. Rutherford always, we're not going to save the world, but we have some major issues. We do. We have major issues in this society. You walk around on the streets, and people are on tons of drugs. We have massive problems with diabetes. We have massive problems with weight issues. We have massive problems with heart disease and stroke and cancer, which is all tied back to the same thing in terms of inflammation and excessive body mass, and these gastrointestinal tract problems tie into all of it. And yet somebody needs to put their foot out there and say, well, you know what, here's the start of the argument. Here's the start of the problem. We're doing it now.
When I say we're not going to save the world, it's when he starts talking about putting 100 clinics out there.
Which we're not going to.
which we can't, which is difficult. And I think that is a takeaway point is when we go to seminars on this, I say in all humility, we go to these seminars, we're interested in going to seminars. We have to go to seminars to get our credits to keep our licenses up. We try to pick ones where we think we're actually going to learn something, and we generally do. But if we sit there for 50 hours, we might pick up a couple of things. We pretty much have this wired at this point in time. But the thing that I noticed at those seminars is you may be confused hearing all of this. You confused from the perspective, you might go, oh my God, it's like so complex. Where do I start? And that's what the doctors are like at these seminars. I mean, it's interesting. We'll get up after the seminar is over and we'll look around and everybody's all excited because they're looking for a way to take care of their patients, but they're like so confused as to where do you start. And so I think that's the strength of what our trial and error procedure and research and so on and so forth has been is if we have somebody who comes in here with one of these issues, we know where to start. We know how, and it starts with a really thorough history, and a history that encompasses evaluating all of this. It's like 17 pages, but that 17 pages takes the complexity out of that aspect of it, kind of focuses you down. Then you go to a history. If you have non-celiac gluten sensitivity, you're going to have neurological issues. Dr. Gates does a head-to-toe neurological evaluation. Once he figures out what parts of the nervous system are not working, you can correlate that with the person's history that they filled out and their symptoms. I do a general systems exam. I go over that history. And by the time you correlate all that, now you've got it down from all the things we talked about to maybe 5 or 6 or 4 or 3 or something like that. Then you can test for that and so on and so forth. And that's where we're trying to take what we do. And that's what Dr. Gates, is talking about when he says, I say, we're not gonna be able to do this, on a wholesale basis. We just have to take care of the people that come here. But anyway, having said that, I think that pretty much covers it. The take home points were, it's not true that it's really important to be free of a gluten-free diet only if you have celiac disease. There are many, 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 many other issues for which you should be gluten-free, and you should have some idea what they are if you review this. Gluten-free diets are not nutritious. Baloney. It's just that if you start eating gluten-free diets and you call it gluten-free diet, eating off the gluten-free food shelves with the little brownie that's gluten-free and the bread that's gluten-free and that's not where it's at. Okay, you need to eat like meats, fruits, and vegetables and things like Dr. Gates said. Basically, just that type of diet. And there's no research to support gluten. Hopefully, we've blown that one to pieces. And that's the data. Really, you need to know that. You need to follow up on this until you find somebody who knows what they're doing with this. There are people out there who are very well educated in the gluten thing. If you have any kind of chronic problem, any kind of chronic pain or chronic disease, trust me, you need to look into this. Now we usually finish up. We didn't do it last week. We usually finish up by saying you can contact us at Power Health if you have any questions. We've stopped taking questions because it was taking Dr. Gates 2 or 3 hours a week. I'm computer illiterate, so it's all on him. And I intend to stay that way as long as I can, much to his chagrin. And so you can contact us at powerhealthnet.com, powerhealthtalk.com. We have information on there as to a lot of this data. You can look up we have over 200 hours now online. You can look us up at powerhealthtalk.com. You can go down to Hangouts. You can scroll down. We have other topics on everything we've talked about here. If we talked about fibromyalgia, peripheral neuropathy, chronic fatigue, whatever we talked about, there's probably an hour about it somewhere on our website. The latest ones are the most updated ones. This was probably updated as of about an hour ago, maybe an hour and 15 minutes ago. So we appreciate the fact that we're getting a growing number of people that are interested in this. So we do it every Tuesday morning, although I'd rather be doing something else. But Doug Gates wants to save the world, so I'm going to help him. And again, so thank you for watching. If you have any topics that you think would be interesting to hear, please feel free to let us know. We want to do things that you're interested in. We don't want to just be sitting here spinning our wheels. And I think that's it. I think we'll see you next week. And hopefully that was an impassioned plea to those of you who have these problems to not be dissuaded by the urban myths, but to look at the facts and follow through on the things that we just got done talking about.
Yeah,
okay.
Exactly. Thanks for watching.